Hello and welcome. Today, we'll be discussing a rare but important topic, bladder paraganglioma. This is a specialized type of tumor that can develop within the bladder wall. We'll explore what it is, why it occurs, how it's diagnosed, and what treatment options are available. The exact cause of bladder paragangliomas is often unknown. While most cases appear sporadically, meaning they arise without a clear hereditary link, some instances are associated with genetic syndromes. These include multiple endocrine neoplasia type 2 MEN2, von Hippel-Lindau-VHL disease, and neurofibromatosis type 1 and F1. These genetic conditions predispose individuals to the development of various tumors, including paragangliomas in different locations, like the bladder. Bladder paragangliomas arise from chromaffin cells, which are specialized neuroendocrine cells typically found in the adrenal glands. In the bladder, these cells are located within the autonomic ganglia of the bladder wall. When these cells undergo uncontrolled growth, they form a tumor. A key characteristic of these tumors is their ability to produce and release catecholamines, such as adrenaline and noradrenaline, into the bloodstream. These hormones can then trigger a range of effects on the body, leading to the various symptoms associated with the condition. The tumor's location in the bladder wall often leads to symptoms related to urination. Bladder paragangliomas are rare tumors, accounting for less than 0.5% of all bladder tumors. They occur most frequently in adults between the ages of 30 and 60, with a slightly higher prevalence in women than in men. Due to their rarity, precise epidemiological data is limited, but ongoing research is helping to better understand the incidence and risk factors associated with this condition. The signs and symptoms of bladder paraganglioma can vary depending on the size of the tumor and the amount of catecholamines it produces. Classic symptoms include episodic headaches, sweating, and palpitations, often occurring during or after urination. These episodes are caused by the surge of catecholamines released into the bloodstream. Other potential symptoms include high blood pressure, anxiety, and hematuria, which is blood in the urine. Some individuals may also experience pain or discomfort in the pelvic region. Diagnosing bladder paraganglioma involves a combination of clinical evaluation, biochemical testing, and imaging studies. Initially, a doctor will assess the patient's symptoms and medical history. Biochemical tests, such as urine or blood tests, are performed to measure the levels of catecholamines and their metabolites. Elevated levels strongly suggest the presence of a catecholamine-secreting tumor. Imaging techniques like CT scans, MRI, and MEN-IBG scans are used to visualize the bladder and identify the location and size of the tumor. Cystoscopy, a procedure involving the insertion of a thin tube with a camera into the bladder, allows for direct visualization and biopsy of any suspicious lesions. While bladder paragangliomas aren't formally classified into distinct types in the same way as some other cancers, understanding their behavior is important. They can be categorized as benign or malignant, although the majority are benign. Malignant paragangliomas are rare and indicate that the tumor has spread beyond the bladder. The distinction between benign and malignant can sometimes be challenging and relies on features like local invasion or distant metastasis. The primary treatment for bladder paraganglioma is surgical resection, which involves the complete removal of the tumor. This can be achieved through various approaches, including transurethral resection, partial cystectomy, and removal of a portion of the bladder, or radical cystectomy, a removal of the entire bladder. Prior to surgery, patients are often treated with alpha blockers to control blood pressure and minimize the risk of complications during the procedure. In cases where surgery is not feasible or if the tumor has spread, radiation therapy or chemotherapy may be considered. Long-term follow-up is essential to monitor for recurrence. Currently, there are no specific, proven preventative measures for bladder paraganglioma, particularly for sporadic cases. However, for individuals with known genetic syndromes that increase the risk, regular screening and monitoring can help detect tumors early, when treatment is more likely to be successful. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also contribute to overall health and potentially reduce the risk of various cancers. The prognosis for bladder paraganglioma is generally good, especially when the tumor is detected early and completely removed surgically. The 5-year survival rate for patients with localized disease is high. However, the prognosis is less favorable for patients with malignant tumors or those with distant metastasis. Recent research efforts are focused on identifying novel therapeutic targets and developing more effective treatments for advanced or recurrent disease. This includes exploring targeted therapies that specifically inhibit the growth of paraganglioma cells and immunotherapies that harness the body's own immune system to fight the tumor.